Based on a true story, a surgeon mistakes his patient's kindness for a romantic connection and develops an unhealthy obsession. During a ski trip, Sarah rides the lift back up the mountain with her fiancé, Duncan. Later, Macy, an instructor, greets the man, prompting his girlfriend to ask how they know each other. So Duncan says he met the woman in the bar earlier while Sarah was taking a nap. After Macy steps away, Duncan notices his girlfriend's dour expression and reminds her that he asked her to marry him, and that should be proof enough that she's the only woman for him. Seconds later, the instructor calls the man over, so he tells Sarah to ski down ahead of him because he'll meet her at the bottom of the slope. However, as she starts the descent, the woman sees Duncan grab Macy's backside, and the split-second distraction causes her to lose balance. Sarah suffers a nasty fall, injuring her leg, and she loses consciousness. In the operating room at the hospital, Dr. Gary Vincent says he can save the woman's leg even though his colleagues suggest that amputation may be the best course of action. Suddenly, the patient flatlines and the surgeon theorizes that a bone fragment must have nicked an artery. Just as the other doctor is about to defibrillate Sarah, Gary manages to clamp the severed blood vessel and her heart rate stabilizes. After the procedure, Paige, the OR nurse, commends the surgeon for a job well done. Hours later, Gary visits the sleeping Sarah in her room to see how she's doing after the surgery. Then he asks the nurse, Farah, for details about the patient and learns that they already contacted her family, but that they haven't been able to find her fiancé. The next day, the nurse brings magazines for Sarah to read and asks how she's feeling. The woman says she's still in a lot of pain and wonders if her doctor might agree to upping the dosage of her pain medication. Seconds later, Gary arrives and Farah relays the patient's concerns, so he raises her dosage to 80 milligrams. Then, the surgeon says she'll need a few days of bed rest before starting physical therapy. Before he leaves, he says he'll come by again tomorrow and lightly touches Sarah's hand. Farah shares that Gary's a humble man because he's won every medical award and mastered almost every procedure. After the nurse leaves, Sarah's roommate Rosie pulls back the curtain between their beds and mentions how handsome their surgeon is. Bemused, the woman says she's never looked at the physician that way. Then, Rosie shares that she's there for her scheduled double bypass surgery. Days later, Gary enters the room and watches Sarah sleep. Suddenly, the roommate pulls back the curtain and asks how she's doing. So the surgeon says they're waiting for a few more lab results and then they'll perform the procedure in a couple of days. Moments later, he wakes Sarah up and does a plantar reflex test to check if she has any nerve damage on the affected leg. Before he leaves, the doctor says he thinks she's ready to start physical therapy today and that he'll drop by later to see how the first session went. Hours later, Sarah meets Jake, the physical therapist, and he assures her that she'll be back on the slopes this time again next year. Then, he lifts her off the wheelchair and lays her down on the floor so they can do stretches. Despite the intense pain, the patient pushes through it with a man's encouraging words. After the session, the woman says she doesn't know if she can do it again tomorrow, so the physical therapist tells her to keep a specific goal in mind and asks what's the one place in the world she's always wanted to go skiing. The patient pessimistically says she never wants to go skiing again after what she went through. However, Jake points out that she seems like the type of person who never gives up, so she reveals that she's always wanted to ski in the Swiss Alps. Later, the incensed surgeon sees the physical therapist wheeling the joyful Sarah back to her room. Inside, the woman checks the drawer beside her bed and finds that her hairbrush is missing. Jake offers to get her another one if she wants, but she says it's okay and thanks him for today. After the physical therapist leaves, Gary enters the room and asks the patient how the session went. Then, he says he'll need new x-rays of her leg to check how she's healing. Before he leaves, the woman thanks the physician and he tells her to call him by his first name from now on. During the next session, Sarah notices Jake's security camera on the ceiling. Moments later, Gary drops by and says he's there to observe and make sure he and Jake are on the same page regarding treatment. When the woman sees the doctor take out his phone, he says he's checking his emails. However, unbeknownst to her, the man's actually taking multiple pictures. Later, Sarah tells Rosie what happened and how she thought it was awkward that he was there just to watch her work out. So the roommate assures her that it was probably just the surgeon monitoring her progress, but points out that it's never happened to her before. Then, the woman uses her crutches to head out of the room so she can find a book to read. As she hobbles along the hallway, Gary takes another photo of the unsuspecting patient. Hours later, Sarah asks how long she'll need to stay in the hospital. So the surgeon says they shouldn't hurry her recovery because they don't want to risk her having another accident at home. During her next session with Jake, the patient manages to take several steps on her own. In her excitement, she loses balance, but the man catches her in his arms just in time. Suddenly, they share a kiss, but quickly pull apart after they realize that it's inappropriate given the nature of their relationship. However, they acknowledge that they harbor mutual feelings for each other and agree they'll consider dating when she's discharged from the hospital. On the day she finally leaves the hospital, Sarah tells Rosie that she kissed the physical therapist. Meanwhile, Gary overhears the conversation by the door and assumes the patient's talking about her romantic feelings for him. Moments later, Jake arrives to wheel Sarah out of the room, and she thanks the nurses for everything they've done for her. Eventually, the surgeon returns carrying flowers in a vase, implying he was about to confess his true feelings for the woman. However, he sees the physical therapist wheeling the patient toward the elevator and angrily slams the vase on the counter. Then, the doctor goes to his office, looks at printed pictures of the woman inside a folder, and then takes out her hairbrush, revealing that he was the one who took it. Days later, Gary speaks to Sarah before her physical therapy session. He shares that Jake has a history of getting involved with nurses and patients at the hospital, and one even filed a lawsuit over it. Then, he asks if the therapist has made unwanted advances towards her. When she says no, the doctor advises her to tell him immediately if anything of the sort ever happens in the future. During the session, Sarah asks Jake if he wants to come over tonight so they can finally talk about their relationship. He says he has baseball tonight but promises they can do so tomorrow. Days later, Gary interrupts the patient's therapy session to ask Jake for her files. When the man says he'll need to make copies, the surgeon annoyedly tells him that he can wait. Then, he takes a seat next to Sarah's wheelchair and sneakily places a medicine canister into her bag. Suddenly, Rosie appears. So the guilty surgeon says he was just looking for his bag, then immediately leaves. The next day, the woman asks Jake about his dating history around the hospital. So he admits that he dated a nurse for a month 2 years ago. When she brings up that the woman sued the hospital, he clarifies that it was because she got hurt in the OR and it happened before they even started dating. The patient says she's being cautious, especially after what happened with her last relationship. So the man assures her that he has nothing to hide from her. Days later, Gary sneaks into Sarah's backyard. Inside the house, Jake notes how much stress the woman's been dealing with at work, so he suggests they take a weekend trip to his cabin. However, she has an appointment with the doctor on Monday, so she calls him to reschedule. Outside, Gary answers the call, and when he learns that she plans on going on a camping trip, he vehemently insists that she shouldn't do it because she might re-injure her leg. In his furious tirade, he accidentally drops the phone, and the woman hears the faint noise outside. After the call, she relays what happened to Jake, who thinks it's unreasonable for the surgeon to forbid her from enjoying outdoor activities. Then, he leaves to prepare a surprise for her. Later, he returns carrying a tent and says they can still go camping in her yard, much to her delight. During her next appointment, Gary tells Sarah that he's seen her latest x-rays and she isn't healing the way he'd like. He thinks she needs a new physical therapist, adding that Jake may be using untested methods on her that might do more harm than good. Later, Rosie asks the doctor if he found his missing bag and he says yes, annoyed by the patient's nosy behavior. Sarah stops by because she promised she'd be there to support her. The blonde mentions that it's weird that their surgeon always seems to pop up wherever she is. However, before they can continue the conversation, Farah arrives to take Rosie to the operating room. While the dazed patient lies on the table, Gary leans close and says it's too bad that she couldn't keep her mouth shut. Then, he places a mask over her nose and mouth, forcing her to inhale the anesthetic gas. Meanwhile, Sarah sees the doctors and nurses urgently hurrying toward a code blue emergency and worries it might be because of her friend. Later, Jake comforts the woman because of Rosie's untimely death. When the man notes how much pain medication she's been taking lately, she mumbles that he's the reason she has to take them. Confused, he asks what she's talking about, so she mentions how the surgeon told her that he's been making the injury worse. He thinks it's ridiculous, but the woman believes it might be best for their relationship if she goes to another therapist from now on. Hurt, Jake tells his girlfriend to see another doctor for a second opinion because Gary has overstepped his boundaries and interfered with her personal life. Sarah counters that he's not one to talk about getting personal with his patients, but immediately regrets saying so. Offended, the man says he's leaving because she has a new physical therapist to find. In the bedroom, Sarah takes her medication and soon falls asleep. Meanwhile, Gary sneaks into the house and rifles through her undergarment drawer. Then, he approaches the sleeping patient, touches the scar on her leg, and brings his face right next to hers. As he's leaving the room, Sarah wakes up after hearing a text message notification on her phone. She sees someone moving in the hall and thinks it's her boyfriend. Downstairs, Gary takes tablets from the medicine canister he planted in the woman's bag and one falls on the floor. Days later, Jake arrives at the house so they can talk about their relationship. At the dining table, Sarah sees the tablet on the floor and realizes that even though she has has 2 medicine canisters labeled with the same type of medication, their contents are different. So the boyfriend advises that she shouldn't take them anymore until she sorts it all out with a doctor. The woman says she'll keep them in the kitchen so she won't get tempted, but while at the sink, she ingests 1 tablet. Then, the woman asks if he came home the other night because she swears she saw someone, but he says he went to the bar to watch the game. However, Sarah says it's weird because she's certain about what she saw and now tablets are missing from her canister. Jake thinks she might have miscounted because she's been taking plenty of medication recently, so she reminds him that she's constantly in pain. When she mentions that Gary gave her a new refill today, the annoyed boyfriend brings up that the surgeon has a crush on her and that's why he told her to get a new physical therapist as a means to eliminate competition. Sarah says the doctor's just trying to help her, so the man emphasizes that even though she wants to continue seeing the surgeon and a new therapist, he won't give up on their relationship. Later, the physician follows Jake as he leaves the woman's house. In the bar, Ginger flirts with a physical therapist, and soon another man, Kenny, joins them. The pair exchange a knowing look, and when their team scores on the game they're watching, the woman plants a kiss on Jake's lips. Then, unbeknownst to the man, Kenny takes a picture of the smooch. The physical therapist politely pushes Ginger away and says he's in a relationship. The pair leaves and Kenny gets in Gary's car, hands over the phone, and takes his payment. Meanwhile, Sarah receives an anonymous message with a picture of her boyfriend kissing a woman. Concurrently, the surgeon destroys the phone and discreetly disposes of it. Later, the patient answers a call from the doctor and she confides that he was right about Jake, so he says he'll pick her up so they can talk about it. At a restaurant, Gary comforts the heartbroken woman and suggests that the right man for her might still be out there. He touches her hand, but she quickly moves it away and says she might prefer to stay single for a while. That afternoon, the woman confronts her boyfriend about the picture, and he explains that the woman kissed him but he shot her down. He insists he isn't cheating and he doesn't even know how she got the picture. Because Sarah broke up with him, Jake barges into Gary's office and accuses the surgeon of sabotaging the relationship. The doctor denies the accusation and doesn't take too kindly to the physical therapist's threats if he continues seeing the patient. Later, Jake speaks to Paige about how Rosie died, and the nurse says she was allergic to the anesthetic gas they used because it wasn't on the chart. However, the man thinks this crucial information should have been on her chart because she's undergone several surgeries. After the conversation, Gary asks the nurse what she and the physical therapist talked about, and she says he wanted to know details regarding Rosie's death. Then, the woman mentions that it's strange that they overlooked her allergy, causing the surgeon to defend that he never misses anything when it comes to his patients. That night, Jake follows Kenny into the bar restroom and demands to know why he took the photo. So the man admits a doctor with a black car paid him to do it, and the therapist deduces that it was Gary. In the physical therapy room, Jake leaves a message on Sarah's phone about how the surgeon set him up. Suddenly, the doctor appears behind him and knocks him out with a weightlifting plate. Then, he tells the man that Sarah isn't meant to be with him, before dropping a barbell on his neck, ending his life. Soon, the woman receives the devastating news of Jake's death. Moments later, Gary arrives to console her because he heard what happened. Due to her suspicions, she places several tablets of her medication in wine and offers it to the surgeon. Meanwhile, the man slips a syringe into his pocket while her back is turned. When she thanks him for being there, he kisses her on the lips, startling her. Suddenly, she starts to feel dizzy, so she sits on the dining table and asks him to grab a pillow for her leg. Then she opens his briefcase and finds her hairbrush and the printed pictures. Horrified, she demands to know how long he's been following her. He reasons that he's simply doing his job as a doctor, but she calls him crazy. So Gary finally confesses that he's loved her since the very beginning. The woman tells him to leave, and the infuriated man says she owes him her life. The patient finally realizes that Jake was right about everything, but as she tries to escape, the surgeon grabs her arm and she falls to the floor. As she crawls away, Sarah starts recording the conversation on her phone. Gary says Jake and Rosie didn't deserve her, and the woman deduces that he killed them. He reveals that he couldn't let anybody come between them, which is why he had to end their lives. Suddenly, the doctor starts to feel dizzy, and Sarah says she placed medication in the wine. She adds that she now realizes why the tablets didn't work, and it was because he gave her a weaker dosage to keep her sick and dependent on him. Meanwhile, Gary stumbles back to his briefcase for his epinephrine pen for a boost of adrenaline. The woman tries to escape through the front door, so the surgeon trips her and she falls to the ground. He says he's the only one who deserves her, which is why Jake had to die. As he's about to inject her with a sedative, Sarah kicks him and calls for help. To subdue the patient, the doctor runs to his car, uses it to knock the woman to the ground, then injects the sedative into her neck. Soon, the ambulance takes Sarah to the hospital, and Gary tells his team that she refractured her leg after falling down the stairs and they might have to amputate it. In the operating room, Paige and the other doctor are hesitant to follow his orders because the patient doesn't seem like she wants to comply with a procedure. Then, Sarah grabs a scalpel, cuts the anesthetic line, and slashes Gary's hand. Paige tells the surgeon to get away from the woman due to his erratic behavior. Seconds later, the patient tells them that the doctor killed Jake and Rosie, then plays the recording on her phone. She adds that they can check the physical therapist's security cameras because it'll show them everything that happened. When the surgeon tries to attack Sarah, she stabs him in the chest with a blade. Eventually, the police place the doctor in handcuffs and arrest him. 1 year later, Sarah's back on the slopes just like Jake said she'd be able to do if she didn't give up.
Subscribe to watch more videos like this, turn on notifications and leave a like to help the channel out. Thank you for watching.